Hi, my name is Francine Crawford. Welcome to my show. Autumn is here. This is a part 2 from last week, Nurses, the bridge between doctors and patients. We're going to continue our conversation with Nurse Whyvette Bonhom. She's going to tell us about nurses in general and their responsibility. And then she's going to give us information on what happens when we ask questions and we're not quite getting the answer that we need. Where do we go? What's the hierarchy? Who's there to help us? So let's continue with our conversation from last week. But let's talk about nursing in general. I just wanted to know, like, as far as nurses, I know I've had experience with nurses, and it seems like sometimes they're stuck, like they're in between the patients and the doctor. They know they're educated, they understand everything, but they seem like what they are allowed to either say or do. Sometimes it seems like it's limited when you're talking to them as like you're visiting and your parent is there or your relative is there. Sometimes it seems like they can say only certain things, but they know so much. And I've had that experience with. I've had experience with some that have actually pulled me aside and say, listen, say it this way to the doctor, tell him this. And if he doesn't do that, then say you're going to do this. I've had that, so I know that the nurses know, and I know that they have power, but how do you feel being a nurse? Like, is it that way where you have to tiptoe and be uncomfortable, or it's just certain rules or something? I don't know. I get that feeling. That's all. I mean,
every nurse, depending on the level of, what they, whether they're LPN or RPN, a nurse practitioner, we all have our scope of practice, and we have to stay within our scope of practice. And one of those things is, yes, I saw your mom's test results. I know what it says. I know what the interpretation is. I know what it means, but it's not for me to explain that to you. A doctor has to, or a provider has to explain that to you. Now, and it's interesting because I am, like I said, I'm in grad school. So one of the class that I'm taking right now is about leadership and management, and focusing a lot on advanced practice nurses. And I just looked at this map. I mean, COVID has changed a lot of things where state nursing boards are recognizing that nurses need to be able to practice to the full extent of their training, to the full extent of their skills and abilities, because a lot of times restrictions are put on us, are put on the nurse practitioners and the nurses at the bedside. So those things are changing. They're trying to, allow us to, be able to. It's my practice, just like you practice medicine, I practice nursing. So let me do what I do. But there are those regulations, and we still have that scope of practice that we have to stay within to protect our own license. Because at the end of the day, if I shared with you, your mom's test came back and it said, this, that, or whatever, now you have questions, and, I could try to explain, but maybe that's not what the doctor, may not be the route that he would take, or difference in opinion. And now I've overstepped, and now the doctor, could definitely, write me up or report me, things like that, of practicing without, practicing beyond my scope.
So what is your job? What is your job? As a nurse in general?
I mean, like, as far as like when there are things to share with the family?
No, just what you're supposed to do. Like, what is expected of you as a nurse for a patient?
Well, I mean, nurses do assessments. We're given orders from physician or physician assistant, nurse practitioner. So for me as a registered nurse, I receive orders, and it's my responsibility to follow those orders within my own clinical and to use my own clinical judgment. So, medications, treatments, wound care. Of course, when I first get a patient, doing a full body assessment, making nursing diagnosis based on what I see, what I hear, what I'm told. So a nurse can make nursing diagnosis, but they are a little bit different than a doctor's medical diagnosis. So I can take your blood pressure and tell the doctor the patient's blood pressure is elevated, but I would not be from that, my nursing diagnosis might be that they're a risk for cardiac, some type of cardiac episode, because my assessment is you are at risk because of your high blood pressure. But it would not be me who would diagnose you with hypertension. Mm-hmm. That's a medical diagnosis. So if I said, oh, you have hypertension, that's not for me to say. That's for a doctor to say. If you can kind of see the difference. So I've assessed it and I can tell the doctor, well, for the last week, their blood pressure has been running high. He's going to ultimately say, okay, based on the nurse's assessment, we feel you have hypertension.
Wanting to know, as far as relationship with people, patients, what do you think is things that can be improved?
Oh, I think that nurses spend way more time with patients than any doctor or even the PAs. And so I feel like establishing a rapport with patients and their families is so important. You're going to see that nurse way more than you're going to see the doctor. And the nurses are the eyes and ears for the doctor, because yes, you can tell me you have pain. I can assess, I can see you grimacing. I can see you struggling. I can see that you're short of breath. Your heart rate is up. I can assess all these things. So it is for me to interpret those things to the doctor and say this. And most doctors are very much now open to nurses and their opinions. Doctors will say, well, Whyvette, what do you think we should do? How do you think we should proceed? Well, I think they need this, this, and that. Okay, order this. And if that doesn't work, call me back, or, may give me some other orders. But I think it's because I have that relationship with the patient that I'm able to, be the eyes and ears for and be the advocate for my patient. It's for me to speak up for them. I think a lot of times the doctor walks into the room and all those questions that you have just kind of, they're like, oh no, everything's okay. I'm good. No. And some, even the family members, the doctor will walk out and they will have all these questions for me. And I'm like, but the doctor was just standing there. And a lot of times they feel more comfortable with the nurse because the nurse has spent that time. The nurse has built that relationship or that rapport, at least with the patients. But we're limited, in what we're able to do. Those are things that sometimes have to come from the doctor. And I'm always I have gone toe to toe, blow for blow with doctors for my patients, and with no regret. If it at the end of the day, and with my managers, nurse managers, I know I did what I was supposed to do for my patient that I was taking care of, and I regret nothing. And I'm not saying that I don't go to work with this expectation or this plan to get into it with a doctor or management. But I'm here for my patients. And at the end of the day, I have to do what's best for them.
But that's how they're raised. That's how it was. Right. You depended on the doctor to tell you. And now, we have to have a voice and we have to say stuff, but we have to ask questions and not feel uncomfortable. And sometimes it is uncomfortable. I mean, you just have this, image that, they're going to take care of your relative. They're going to take care of you. They're going to tell you everything. But they're human, one. And sometimes they may be overwhelmed. They may be busy. They may slip their mind. Things like that happen also because they're human. And sometimes they're overworked and things like that. So, we have to have a voice, and we have to say, ask the questions. But what happens if you're not getting the information or what you're asking for? Where do you go? If you're talking to the nurse and you're talking to the doctor, like, where do you go? Do you go to administration? Do you go to is there someone else above that? Like, what is that person?
Oh, absolutely. I mean, of course, from the nursing perspective, there's always, the charge nurse. And, I'll be honest, the charge nurse is usually just another nurse who has been given that responsibility for that night. Because there are plenty of nights I walked in and they're like, "Oh, you're charged tonight." I'm like, nobody. Okay. And you still have your own patients to take care of. It's just that now when so-and-so is complaining because the room is too hot or the food was too cold or whatever, oh, let me get the charge nurse. Ma'am, you're a nurse, just like order them new food and call maintenance. Why do you need a charge nurse for that? Right. But just an example. So there's a charge nurse, but then there should also be a supervisor or manager. Mm-hmm. But administration, I mean, people don't may not realize the power of the pen. The fact that hospitals, the reviews and the surveys that you do. I mean, of course, it may not help in the immediate moment, but change happens. People, doctors are, especially if the hospital is one that they want to create a culture of, respect and patient first, and there's a shift. There's a shift that is happening in healthcare, because I work in the operating room. So once upon a time, it was okay for a surgeon to throw instruments and throw tantrums and be rude and disrespectful and cussing and, oh, yes. I mean, and the patient's asleep, so it's not a patient thing. It's more of how they were disrespectful and just
the other people that they're working with.
Towards nurses, the nurses, anesthesia, towards the assistants, towards the people that they're working with. Really, that culture is not acceptable anymore. I do not have to stand here as a nurse and accept you behaving this way. I don't have to do that. And it's the same thing for patients. Like, just because he's a doctor and you're a patient, it doesn't mean that you have to tolerate inappropriate behavior. And then it means you go to I want to speak to someone in administration. I have a complaint, or most hospitals, you can file a grievance. And then someone who is supposed to be impartial, and now the department is leaving my mind. But when you want to file a grievance, there should be someone from that department who will come up and discuss whatever issue it is that you're having. And they are supposed to come up with an action plan of how we're going to resolve this issue. So a lot of times people are like, oh, it's a waste of time. They don't care. They're always going to defend, the staff or the nurse or the doctor. But believe it or not, this is customer service. This is about, does your hospital want to thrive? Because once I take to the internet, it can affect their business. And the reputation of the hospital. And people now have a choice. I'm not limited to my access to care. I can go somewhere else and receive care if you're not going to give me the care that I deserve.
Okay. Well, you said that you're continuing your education. and you've been in this field for quite some times, and you love it, and you have passion for it, and this is what you think you're called to do. So, what are the things that you would like to see? What are the things that you would like? Because you're not just going into it and keep getting educated just because I'm sure you're doing okay now, and you have a job that you like or whatever. But there must be something that you want to do or you want to see happen in the industry because you love the industry.
My concentration for my master's in nursing is public health. And, being a change agent for the profession, for healthcare, having a say in policy. I'm not political at all. I currently, one of my multiple jobs. I work for the federal government. It's federal occupational health. I only do it like once a week. But it's, not that I do a lot of clinical things. A lot of the federal workers are still working from home, so the clinics are pretty slow. But they have me there for medical emergencies and things like that. But just some of the networking that I've done with even alumni from my university works for Department of Health and Human Service, and just knowing that eventually I want to be able to see the profession that I love, that I've been a part of for all these years. Like, I want to see some positive changes. And, a lot of people are pushing for the things in the hospitals and, but there's a need for who's advocating for those long-term care facilities, those subacute facilities, for the mental health facilities. Because I've worked in a lot of different places and I've seen a lot of different things. I worked in maximum security in a state psychiatric maximum security facility. And the things that went on there prior to me coming there, and then even while I was there, it's just like, something has to change. Like, these individuals, yes, they have mental health issues, but they're still human beings. Exactly. And they should be respected and treated as such. Yes, this person has dementia, and they may not remember from one second to the next, but you can't treat them that way. And just making sure that not only are we creating an environment to make it uncomfortable for people to be that way, but to make sure that there are laws and policies that say you cannot do that. It's not acceptable. It's not okay. So.
Okay. See, I knew it was something bigger. I knew it. But that's great. So you believe in change. You believe that there's room for change, and you believe that it's possible.
And there's need.
And
I believe it's possible. I think there's a need for it. I don't think it'll be an easy journey, but I don't think things will change overnight. There will always be those people who will try to block positive change. While I was working on my bachelor's degree in nursing, it was like so much talked so often about the Affordable Care Act, or what they call Obamacare, and just, recognizing like all the changes. He just like, it was something put in place so that we all have access to care that is accessible, it's equitable, like it's fair, we all have, and recognizing that healthcare is a human right. It's not, it shouldn't be treated as a luxury. It's a right. It's not a privilege. It's not a privilege. It's a right. But there are still those people who, want to fight the very simplicity of we all should be taken care of.
Exactly. It's like, it has to be across the board. You can't just be selective of who gets care or who gets good care or have different levels of care for this area or these people or, things like that. If you can afford it, you can get it. If you can't afford it, oh, well, it shouldn't be like
and
that.
Even in long term, in looking at elder care and geriatrics, the fact that a person could work all their life, have, and then at the end of life, when they need care, the fact that the way things are written, the way policies are, like, you have to pretty much just go to your grave with nothing in order to receive good care. I was like, I don't know. It's just, it just doesn't seem right.
Right. It doesn't. It's like the care that you deserve at the end of your life, especially people are living longer now. So they're like 80s and 90s and they've saved or they worked hard or they gained some things. They got some, real estate or whatever. And now if they are that sick that they cannot take care of themselves, they have to take that, whatever they have in their valuables, they have to take that to pay for their care until that runs out. And then it'll kick in, Medicaid, whatever will kick in. And that seems unfair to me too. I learned that and that seems very unfair to me, but we have to know about that ahead of time so we can do things and to try to, allocate the money or the business or whatever that we have years before, right. So it just doesn't go to that because, if you didn't have anything, you get care. You could go to the same facility and you're supposed to get the same care. So why does this person who has all this has to lose everything and get the same exact care? You're not getting any different care. Right.
You don't get to like leave a legacy and pass things down. Like, who knows that like tomorrow I'm, gonna have a stroke and need all this care. Like, nobody knows that. So I didn't know like 5 years ago, I should have been like putting everything in my kid's name or gifting my loved ones with these things so that, I don't have to, just rid myself or liquidate everything in order to receive care because I didn't know that I was going to have a massive heart attack and, need these things at the end of life.
Well, thank you so much. I appreciate all the information that you've given us and sharing with us and taking the time. It was very valuable. And, I'm very excited about your future and about you, helping to make change. I mean, you may not do everything, but someone has to start, and just like you're out there, there's someone else out there that wants to do it too. And you'll find that as you go along and you'll find people to, work with you on it. So, it'll happen. Things don't happen overnight, but somebody has to start it. So thank you for caring enough to do that,
Yeah, absolutely. Absolutely. Well, thank you for having me on the show. Hope I didn't ramble too much. But,
no, it's fine. It's fine.
When you're talking about something that you really love, it's hard to just like cut it off.
No, I get it. And I like that because you're willing to talk about it. You have people, I've asked plenty of people at the level of, the Department of Aging and different things like that and different departments and Alzheimer's or whatever. But the people with the title, they say, yeah, but they don't really they're not giving you the time. You need somebody that's in there, and or they have so many restrictions. You got to talk to their marketing. You got to talk to, it's like, okay, all right. My show will be over and done. We'll be retired by the time we get through that. So
all that red tape.
All that red tape. Yeah, like really seriously. But they're in what gets me is that they're in the business of helping and wanting to get their programs and stuff out there so people know, so people have things because you have it to give. So why not let everybody know? What do you care? What do you care if only 10 people find out, there's 10 people that you can help, because that's what your business is, right? So that's why I don't understand, but I'm learning as I do this. So, but thank you so much. I really, really appreciate it. And I look forward to seeing what lies ahead for you.
Oh, thank you so much. And thank you for doing this. I think, a lot of people don't know what to do when they're in that situation of my mom or dad are aging, and how, aging in place, or what do I do? What are the next steps? And how do I make sure they're well taken care of? And, a lot of unanswered questions when you're entering that territory. So having a podcast like this is important, and it, I'm sure it's helped a lot of people. So thank you for what you're doing.
Oh, thank you. Thank you. All right. Well, good night.
Good night.